Continuing with our skeletal system, where we've arrived at the pelvis, and we're going to learn about the bones that are fused together that make up this structure that you may have heard of called the hip bone. So these hip bones, it's important that they're very strong and maintain their integrity because the total weight of the upper body rests on this region. This region also protects several organs, such as the reproductive organs, the urinary bladder, and portions of the large intestine. Also the area where the femur articulates with. So the pelvis is composed of 3 fused bones. These are not independently mobile, they are fused together. We have the ilium, located here, the ischium, located here in purple, and then the pubic bone. And that's located right here. The sacrum, which is in green here and here, anterior and posterior view, is part of the vertebrae. It's important that we make that distinction of separation that is technically not part of the pelvis region here. And that hip bone you can see here again are 3 bones composed together, fused together, make that hip bone up. Remember that sacrum is part of the vertebral column and is not part of the total hip bone. Gender differences of the pelvis. So if you want to identify a skeleton as being male or female, you typically look at the hip bone here. Now, rather than memorize degrees and numbers, for women it's 80 to 85, a little bit wider angle, which help with the birthing process, and men 50 to 60 degrees. There's kind of a little trick here. So if you take your hand, and the angle formed at the pubic arch is approximately the angle between the thumb and index finger, that would be indicated that would be a woman skeleton. However, if the angle between the index finger and the middle finger, if it matches this, then we're looking at it's probably a male. So this can help you identify quickly a male or female skeleton by simply looking at the pelvis and the degree that we find here at the pubic arch.